there's stages of demonic attack. Okay, so there's actually 4 stages that we use in my model for identification of a demonic attack. And so the first stage, you wouldn't be able to really know any difference between, just an anxiety problem or depression, or something spiritual going on. So in those cases, it's best to just keep your spiritual life healthy, which means, doing the normal things that a normal Christian should do. Go to church, pray frequently, and if you're feeling anxiety and depression, go and see a doctor. Don't come to an exorcist, go to see a doctor. And then in stage 2, it starts to get more severe, but again, still not completely different from mental illness. So that's where you start to see suicidal ideation, night terrors, nightmares, anxiety, loss of reality. These are things that are all very familiar to anybody that works within clinical psychology. But if it's a spiritual causation, then it's demonic obsession. We would call that demonic obsession. And then it can lead into, if it's not treated, into demonic oppression. That's when you start to see physical illnesses that traditional treatment does not resolve. And that's the big factor for us. If they have a long medical history or psychiatric history and nothing is working, and you talk to the doctor, you talk to the psychiatrist, you talk to their counselor, and they say they've done this, and this, and they don't know what else to do because nothing seems to work. And then you have some of the other identifying markers of a demonic event. That's when you start to take it more seriously and say, okay, now we need to look at spiritual solutions because the conventional ones are not helping. And so you might say, well, what exactly are those demonic markers? Well, those are the things that are not clearly they're not clearly falling under the umbrella of a conventional illness. Like, for example, these are more of the exaggerated forms, the more rare ones, but they are ones that are typical to possession, and because possession in itself is rare. The ability to speak in languages that you've never studied. That's something that the conventional arena of the medical field would not have a good explanation for how that happens. Superhuman strength. Now you might say that's adrenaline, but I've seen a 12-year-old girl knock 6 200+ pound guys off of her with one push. I've seen things that even adrenaline you'd have a hard time explaining it in that context. There's also clairvoyance and clairaudience. The ability to know things about somebody that you've never met. How would you have that information? What kind of psychological or scientific explanation can we derive from a person having knowledge about something that only you know, and yet they know it now, as if it's been revealed somehow, or they hear conversations that they're not privy to. There are situations where the exorcist and our team, for example, would have a briefing before we go in at another location, many miles away from the client, and then we would arrive there, and the client would know everything we talked about. That's kind of an example of clairaudience. They somehow heard the conversation. I've even seen their eyes change, and I don't mean this in some kind of vague sort of change in the way that their eyes look. I'm talking about I've seen pupils change from what is a standard human pupil to something that would be identical to something you'd see on a snake. It's a very abrupt change and very shocking when you do witness it. There's also characteristically in every one of these cases a disdain for religious or blessed objects. And these are not people that are necessarily anti-Christians or they hate religion for some reason. There's a lot of people like that in the world. But this is a person who is usually in many cases, a believer in God, a believer in Jesus Christ. If somebody who professes to be a Christian, sometimes even a regular churchgoer, somebody that's at Mass every Sunday, and now all of a sudden, they have this complete disdain, almost an intolerance to being in the presence of religious articles like crucifixes or statues, icons of religious figures, that type of thing. Even coming into church, it can seize them. We it's very common we like to, it's best to perform exorcisms on holy ground. And so it's best to bring them to a church to do this rather than to go to their home. And very often the client will start to seize about 15 minutes or 10 minutes before reaching the church. And then when they arrive, they are completely stiff as a board and in a complete stupor, where they appear to be unconscious. They are completely stiff. You cannot move them, and just the idea or thought of going into the church causes this sort of seizure to happen. And then there's other things like odd, inappropriate behavior, and then there's really extraordinary things like levitation, bilocation, doppelgangers, objects moving on their own, disturbances within the environment. That's even less common than the other ones, but these are things that can happen and do happen during genuine possession events. And I don't know any psychologist, psychiatrist, or medical doctor that could come up with a very good scientific explanation for why those things occur. That's really more in the realm of spirituality.